Thinking of a hip replacement? Stay tuned as we go over the good, the bad, and the ugly. Hey everyone, welcome to Thoracic Park. Here we talk about athlete injuries, celebrity surgeries, and how to get you back to being active and pain-free. Today, we dive into the world of hip replacements. Hip replacements are one of the most successful and cost-effective surgeries that we perform, if not the most successful orthopedic procedure. More than 1 million hip and knee replacements are performed in the US every year. But before you decide on getting a hip replacement, there are a few things that you should know and some things you need to look out for. Stay tuned for the end where I'll share the top controversial questions that you will probably ask your surgeon. So, who gets a hip replacement? Well, it's going to be those individuals with arthritis most commonly. And arthritis can come in a multitude of different types. You can have your old-fashioned osteoarthritis, or you can have things like rheumatoid arthritis. There are other things that can go on in your hip as well, like avascular necrosis or hip dysplasia, or things like trauma or infection. Now, all these things will affect your hip differently, but the end result is really the same. That classic hip bone joint that you have in your hip is producing lubricant type fluid from the cartilage. And when that cartilage gets worn out, what develops is pain. So even though these processes may be working in your body differently, the end result is the same, and that is pain. You'll feel pain in your groin, you'll see a few doctors, and eventually someone will get an x-ray. And your x-ray will look something like this. Here you see circled in blue the hip joint on one side, and the cartilage represents a black space, which you can sometimes see here in yellow, with the yellow arrow indicating the faint joint space that's remaining, and this is the side the patient is symptomatic on. If you look at the other side with the red arrows, you can tell there's still a little bit of joint space left, and this side the patient is not symptomatic. Here we see what the hip looks like after the hip replacement, again with the red arrows on the other side, demonstrating that joint space a little better and how it is still preserved. Fast forward 8 years, and this patient's still doing well on the side with the hip replacement, but on the other side, they're now becoming symptomatic, and you can see circled in blue, that hip joint doesn't look so good and looks kind of like the hip joint did on the other one previously. But hip arthritis is a spectrum of disease, and as you can see here, it can get quite bad and create a lot of deformity and really an obliterated joint space here, and this patient is quite symptomatic. But before you get excited about getting a new hip, you should try all the conservative measures first. There are a lot of things that we can go over, but really just touching on some of them. You can start with medications. Advil, Motrin, Aleve, or other anti-inflammatories are great at reducing some of the pain if you can tolerate taking it. And that anti-inflammatory effect really helps reduce the bone-on-bone inflammation that results that your body can feel. There are stronger medications that you can take, like tramadol, for example, but you really want to try and avoid taking narcotics at any cost. There's a lot of studies out there that have shown that patients who take narcotics before surgery do worse than those who had never been on narcotics, whether it means longer time spent in the hospital or needing narcotics for a longer period after surgery. The fact remains that you're gonna need narcotics after someone cuts into your hip. So do yourself a favor and avoid it beforehand so that your body isn't used to this medication going into it. But the most important thing you can do for yourself is lose weight. When you walk, your hip joint sees 4 times your body weight. So if you were able to lose something like 15 pounds, your hip joint would actually see 60 pounds less across the hip joint. And so that's how important weight loss really is. I'll have another talk about diet, weight loss, and how it affects your orthopedic health. And once that's posted on YouTube, you'll be able to find that in the description below. So make sure to click the subscribe button, click the notification so that you're aware when this gets posted. Now, another alternative can be like a cane or something that helps you walk. And again, that helps offload the weight that your hip joint is seeing. Now, remember, if you're having pain in one hip, you want to make sure to use a cane in the other hand. That's how it works, and that's how you can help offload the weight that your hip joint in that painful hip is seeing. Injections are the hot topic these days. Steroid injections, gel injections, PRP, the list goes on. But really, steroid injections have the longest track record in the literature to support them for use in arthritis. Now, if you have arthritis in your hip and you're thinking about a steroid injection, it's good to kind of get a sense of what's going on. Steroids are this super boosted anti-inflammatory that are being delivered directly into your hip joint where that pain is going on. And that really helps cool things down and reduce the level of inflammation and pain that you're experiencing. Now, steroid injections tend to be great early on in the disease process. So if you're really at an end stage arthritis picture and you're bone on bone, and there's really no more joint space, not only is it hard to get the needle in to deliver that, but you will also see less of a benefit. Also, steroids have a diminishing effect over time, meaning you may feel a great relief in your pain after your first injection. Hopefully that injection lasts you months, if not years. But by the time you get to your second, third, or fourth injection, the benefit you feel may be far less. The steroid injections also will take a hit to your immune system because of its anti-inflammatory and steroid effect. So it's something to be aware of and when you decide to get this, because the truth is most surgeons won't operate on you for 3 months after your last injection. So it's good to discuss that with your surgeon. Also, steroids can boost or really spike your blood sugar levels. So for diabetics out there, you really want to be careful, or at least monitor your sugar levels a little more carefully after your injection. Injections are also great because they can help diagnose the problem. So if you have other things going on like knee problems or back problems or soft tissue issues, and you also have arthritis in your hip, but you don't really know what's going on, it's nice to have an injection, because if the injection actually takes your pain away, well, we know that that's where your pain was coming from. So it's a good diagnostic tool in certain situations as well. Now, I have to take a deep breath before we get into PRP. This is a sore spot. There's a lot of mixed literature out there, and I'm actually going to do a dedicated talk just on PRP in orthopedics. So again, once that video is completed, you'll find it in the description below so that you can follow along and get a better understanding. But really, in brief, PRP is where a little bit of your blood is taken from your arm and it's spun down in a special centrifuge machine, and a specific layer of cells are removed, taken out, and injected into your site, whether it be your knee or your hip in this case. And the goal being that those, quote, stem cells, which is what's advertised, are going to supposedly help trigger a course of events in your joint to help improve pain, reduce the effects of the arthritis, and some people even go as far as to claim that it helps regenerate certain tissues. And really, most of this has not been proven, and you need to understand that the literature is very mixed in regards to how PRP helps in cases of arthritis. Not to mention, PRP is often not covered by insurance, so this is something to consider where you have something that's much lower risk, like steroids or gel injections, but have a bigger upside and may cost you less. So when cost plays a role, it's something to be aware of. But overall, injections are a low-risk tool that you can help push surgery off as long as possible, and something that's important to discuss with your healthcare provider. But what are some of the issues? Well, there's a lot of issues with hip replacements. There's a lot of things that can go right, but there are also some things that can go wrong. Now, your surgeon will discuss these with you before you get a hip replacement, the risks and the benefits and the alternatives of getting surgery. But in brief, some things that you need to be aware of, and some of the most common issues with hip replacement are things like infection. Infections happen all the time, and really anytime an incision is made on your hip, well, it's being exposed to the air, and that's where all the bacteria lives, and now you're allowing it to get in. You'll get antibiotics before surgery is performed, and that's usually done with an IV while you're asleep, but that can only minimize the risk so much. You're putting an artificial implant inside your hip. Now, this is all sterile. The operating room is all in a specific environment, minimizing these risks to less than 1%. But you just have to be aware, because an infection can be catastrophic if it happens and will likely result in you needing another surgery. Some of the other issues include fractures. Most fractures happen after surgery, whether you have a fall during your recovery or years and years later. smaller chance that a fracture happens during surgery, but in those cases, again, you're in a controlled environment. Your surgeon will be able to take care of something like that. You may come out of surgery and they may ask you to not walk on your hip or put full weight on your hip for a couple weeks to let things heal in, but that's unlikely and uncommon. Other risks of bleeding, nerve injuries, these are all also very minimal. A common issue and complaint that people talk about is leg length discrepancy. They feel when they wake up from surgery, well, hey, one leg feels longer than the other. I didn't have this sensation before surgery. And let me assure you that in most situations, you had arthritis, which means that joint space you had was lost, or you had bony erosion, meaning your bones were wearing out into one another and getting a little deformed. And over the time, over the years, one leg may have felt shorter and your brain may have compensated. But after a hip replacement, that's being restored to your other side. So in most cases, although you feel a difference, there's actually no true difference. And again, this is something that you can talk about with your surgeon. In fact, most people have some sort of discrepancy in their leg length, and you can tolerate even up to a centimeter or two without ever noticing. So now, the top controversial questions that we get all the time. Number one, how active can I be after my hip replacement? Well, you can think of your hip replacement a little bit like a new set of tires, right? So you can take it to the racetrack and burn through them, but you really want your tires to last you as long as possible. Again, it goes back to this thought of you want one surgery and that's it. So yeah, there are some patients who run a half marathon, some that go hiking big mountains after hip replacement, but you really want to find a nice balance. Personally, I would suggest you avoid the pounding type activities like running if you can after surgery. And although some surgeons will tell you to go do anything you want and treat your hip like it was your old hip, I would suggest and highly recommend that you don't do that. Again, this is a new set of implants in your hip that you want to be able to maintain and keep long term. Number two, what about the approach? Anterior approach, posterior approach, what's the difference? What should I get? What do you do? Well, every surgeon's different, and I think about it a little bit like a pitcher's pitch. Right? Everybody's got a different pitch, but as long as the ball makes it where it needs to get, then the job gets done. And really, you want your surgeon to do what they're comfortable with. And the anterior approach is something a lot of people will come out and talk about as being this new, innovative technique. Well, the reality is it's not. The anterior approach to the hip has been around for many years for other reasons aside from a hip replacement, like a hip infection is one of the reasons why somebody would get an anterior approach to their hip. But the difference being the anterior and the posterior is that people think the anterior approach allows you to avoid removing some of the muscles and tendons that hang out in the back. And by doing so, you minimize the risk of having a little bit of a limp after surgery. Now, with that said, the posterior approach is really a low risk of something like this happening, or it would be pretty mild. Now, when those tendons are taken off the bone, they're reattached at the end of surgery. So really, you want your surgeon to perform the type of surgery they are most comfortable with, and you can probably focus a little less on which one of the two are going to be done. Number three, minimally invasive. I don't really understand this term when it comes to hip replacements, and most of the literature doesn't either. What is minimally invasive? Well, there's no real consensus. Is your incision going to be 3 inches, 4 inches, 6 inches? Most patients really harp on the size of their incision. Yeah, your incision may be a little bit longer than your neighbors, who both of you got a hip replacement, but you may have some more soft tissue than they do, and that's really what dictates your incision length in most cases. Nowadays, there are a lot of tools that help us get a more minimally invasive approach to the hip and avoid needing to do a lot of soft tissue stripping and a lot of removal of muscles and tendons. In a lot of cases, muscles are divided. There are very few that need to actually be peeled off, but they're, again, reattached at the end of surgery. And so this term minimally invasive is something we get a lot, but is pretty irrelevant when it comes to your outcome overall. And so again, I would try not to focus on that. Number 4, what about after surgery? Should I go home? Should I go to a rehabilitation center? Should I do my surgery and go home the same day? There's a lot of questions that come up, and the literature is actually pretty firm on this. Most patients do better when they go home after surgery. If you can, you should try and go home after surgery. That's the alternative to going to a skilled nursing facility or rehab facility. The studies have shown over and over again that patients who go home do better. They have higher rates of satisfaction. They have lower post-operative pain. They take less narcotics, and they're able to achieve a faster recovery. So again, you want to try and go home if you can after surgery. Now, there are some medical reasons or other issues that may arise that will push you to go to a rehab facility, like social reasons, for example, and you may not have help at home. And so those things aside, if you can, you should try and go home. And what about outpatient surgery? Well, again, the literature is pretty firm on this. Patients who get outpatient surgery have better satisfaction scores, have lower postoperative pain, have quicker recoveries. Part of this is related to the anesthesia that you get. The anesthesia is a little bit different in an outpatient setting, but also patients tend to be healthier who are getting these surgeries in a surgery center of sorts. So these are things you can talk about with your surgeon and see if you are qualified or able to get surgery at an outpatient facility. But if you can, I think it's a great idea. The literature also seems to support that patients who go home the same day tend to do better. Again, even when they controlled for the same type of patient, meaning two healthy patients, one went to the hospital, one went to a surgery center and went home the same day, the one who went home ended up doing better. So if you can, you should. All right, folks, well, that's it for me today. Hopefully this was educational and helpful for you. Make sure to leave your comments down below if there's anything else you want me to go over, any questions you have about hip replacements or any other orthopedic injury or procedure. Make sure to drop a line. I'll address it when I can. Don't forget to hit the subscribe button, set your notifications, and we'll see you next time here at Thoracic Park.